Hello, everybody, and welcome. Thank you for joining us. We're excited to have you back with us today, or if you're here with us for the first time, welcome. This is the fourth session of the STAR Center's Burnout 201 webinar series. My name is Mariah Blake, and I'm the program manager here at the Association of Clinicians for the Underserved. Today, we'll be picking up where we left off during last week's session with Cheryl Fattibene, discussing employee satisfaction and turnover. We just have a few quick housekeeping items to go over before we get started. All right, just a quick reminder for anybody who's not been able to join us for previous sessions in the series. This webinar series is produced through the STAR Center. We're the Workforce NCA, the Workforce Project of the Association of Clinicians for the Underserved. ACU is a national nonprofit focused on the recruitment and retention of clinicians in underserved areas. We do that through projects like the STAR Center, National Health Service Corps advocacy, and training and resources for clinicians of all disciplines. Doing all that work is what brought us here to this webinar series today, and we're glad to have you with us. As I mentioned, the STAR Center is ACU's workforce project funded through a national cooperative agreement with HRSA's Bureau of Primary Health Care. Through this NCA, we're able to create and share resources and training for health center workforce staff free of charge. If you're new to the STAR Center, just now hearing of us, hi, welcome. I hope after this webinar session, you'll head over to our website listed there at chcworkforce.org to get to know us a little bit better. We've also included the contact information for all of the STAR Center team. Allison Abe-Sacra is our Vice President of Training and Programs. My name is Mariah Blake again, our Program Manager, and Suzanne Spear is our Workforce Director. Please feel free to contact us, any of us, at any time. I will be handling the technical side of today's presentation. So if you have any questions during the session, feel free to shoot me an email or send a chat in the chat box, and I'll try and help you out. Our final actual housekeeping pieces. We are recording today's session, and we'll send out a follow-up email with instructions on how to access the recording and a copy of the slides by tomorrow morning at the very latest. So keep an eye out on your inbox for that. You can also access a copy of the slides in the handout section of your control panel of the GoToWebinar control panel throughout the presentation. Please ask questions. We love to help answer those questions. We'll use the last 10 to 15 minutes of the hour to answer any questions that come in. Feel free to send those in at any time, but we'll answer them towards the end. If you have any burning questions after the session, feel free to email anybody on the presentation team, and we'll try our best to help you out. I hope you'll use this time to relax and have a little bit of fun with us as you listen to the presentation. And with that, I will hand over the controls to Cheryl to take it away for today's presentation. Thank you.
Thank you so much, Mariah. I really appreciate being here, and thank you and welcome to everybody. This is part 2 of the Clinician Burnout series, and I wanted to thank everybody who's joined us today for this important information and content. My name is Cheryl Fattibene. I am a family nurse practitioner by training. I have been in practice for nearly 30 years. I have worked mostly with underserved populations throughout my healthcare career. I currently serve as the Chief Nurse Practitioner Officer at NNCC in Philadelphia, where I'm joining you today. And I do have to say, as I was watching the initial slides coming through, that I am a graduate of the National Health Service Corps program. So it's actually really a pleasure to be here after having the opportunity to work with those both at ACU and the National Health Service Corps in order to help get my training. So thank you everybody again, and thanks for joining us today. And this is part 2 of this series on burnout. So some of the partners in the work that we've done to come up with this content are as follows. We've partnered very closely with Arizona State University, as well as the National Center for Interprofessional Practice and Education, 2 really excellent resources for you if you are looking for interprofessional working collaboration, as well as our local American College of Physicians, which is located here in Philadelphia, who helped to develop some of this content. So the objectives for today are as follows, and just as a reminder that this is a recap of part 1, so we'll briefly go back over what burnout is, knowing and understanding what it is, and a brief mention of the patient-centered medical home framework, as well as identifying techniques to address burnout, both organizational and personal strategies. Thirdly, we'll be identifying specific leadership strategies for moving beyond burnout using SMART goals and also PDSA cycles of change. And lastly, we'll talk pretty extensively about the use of improvement science to set aims, establish, develop, and track changes in the work environment. So again, as a reminder, and we talked about this last time, very briefly, burnout is that state of chronic stress that many of us have felt or are feeling and have felt over time. We may be physically or emotionally exhausted. We may feel somewhat detached, maybe a little cynical about the work that we're doing, not quite as tied in as we were before, as well as feeling ineffective or somehow lack of accomplishment. The nature of burnout is very insidious and does creep up on us slowly over time, which makes it harder to recognize it. But our minds and our bodies do give us warnings along the way. And we want you to be able to recognize it before it's too late and burnout has really taken you over. So again, last time we talked about the patient-centered medical home organizational strategy. So if you or your organization is a patient-centered medical home, this would be a great starting point for you to begin to have conversations with leadership, or if you're in a leadership position, we're going to go back briefly and just review how being in a patient-centered medical home has many of the areas needed in order to help protect against burnout within the organization. So those are listed here, and NCQA has been instrumental in giving us a team-based model of care within the patient-centered medical home. And as you can see listed here, and we talked about this in a little bit more detail last week, it's focused on staff, about collaborations, about putting the patients and family in the center of care, as well as having a governance system, the EHR, communicating with both patients and also amongst providers, the use of quality improvement, and then being that medical home for your patients. So that framework is extremely important, even if you're not in a patient-centered medical home model, because those are the elements of a team-based care environment that will help to move you to a better place if you are experiencing organizational burnout or if you're experiencing that personally. So speaking of that, we're going to start out today with talking about some personal strategies. And I know we had some questions last time about this and how do we as individuals deal with burnout and how do we recognize it and how do we address that. So we're going to start today with something I think probably everybody has seen and knows about. We're going to talk about Maslow's hierarchy of needs. We all know that these are 4 fundamental areas of human needs that we need: physical and psychological safety. We need meaning and purpose in our lives, choice and autonomy, as well as camaraderie and feeling as if we're part of something bigger than us and part of a team. And all 4 elements of these human needs will not be resolved before addressing local impediments that may be impacting on your joy in work. Actions and commitments to addressing all 4 will ensure moving towards joy in work. So as we can see here, again, looking at this framework and taking Maslow's hierarchy of needs and applying that to the IHI framework for joy in work, and it's very similar, particularly around the areas noted here where we need that physical and psychological safety, that we need to have choice within our environment to some extent, and trust, and as well as autonomy in our work. And then, as we know, most of us spend more time at work than we do with our families, so work does become a second home for many people, and there needs to be a sense of camaraderie and teamwork there in order to feel that it is a functional place and a functional home. as we set out on this journey of looking at where we are and thinking about our own personal needs and where we are along the continuum of possibly being burned out, the first thing you really need to do is take a step back before you can travel down this road. And you really need to take a look at your own needs. So what about what's going on right now in maintaining Maslow's hierarchy of your own personal needs in terms of trust, in terms of, physical and psychological safety, meaning and purpose, and that camaraderie? So think about your passion and what you're doing now. And also think about if what you're doing is what you love or what you had decided you would do years ago, or if you happened into the position that you're working in by happenstance or chance. Also very important to think about, what do you have the power to change within your environment? Because there are some things that we do have the power of change over and others that we do not. So begin to think that through, and then also think about where you'd like to see yourself in the future. It's important when you're doing this and you're doing a personal assessment to take some time, maybe get a notebook, sit down, and really write out the answers to these questions. And be as honest with yourself as you can. You don't have to share them with anybody else, but it's really a way of doing a personal inventory so you have a sense of where you are, again, on the continuum of well-being. Because unless you know where you are and where you'd like to go, it's very difficult to make both personal change, but also to think about making changes at work. We had talked about this last week and things that we can do to promote our own personal well-being, and there's a long list of things here that you can do. Sleep is probably one of the most important ones, as well as exercise and also healthy eating. Think about what you're doing on a day-to-day basis to be able to promote personal well-being, whether or not your organization may have some things in place that might be able to help with doing this. I know that some organizations will have yoga classes or do mindful meditation or possibly other things. Some don't have anything except, coming in and going to work. So think about how you're doing these and begin to think about this in the context of not only what you may be doing, but what you may like to do more of, and add it to that list that we had talked about with the personal inventory of maybe one of these things that you'd like to work on and do better on for yourself and for your family as well. We talked last time about trust and safety and how these are really building blocks for creating that team environment and being able to work effectively within a team. Without that trust and safety, as we saw from Maslow's hierarchy, it's very difficult to develop a place where we feel safe and where we can work to our highest potential. So this, again, for those who were not on the webinar last week, was something that I had shared. This was a study that came out of social psychology, published back in 2008. And it looked at how people perceived walking up a hill and to estimate that climb if they were by themselves. And then they put somebody next to them who was a trusted friend, and then asked them to gauge the height of the hill again. And what they found was that people who stood alone at the bottom of what looked like a very high hill, the hill seemed even higher than those who stood and looked at it with a friend or a colleague or someone that they trusted by their side. So that's just an important point to think about, that teamwork doesn't happen alone. Teamwork happens in a group environment, and we're all able to do what we do better because of the teams that we work in. So how can we use improvement science to create change? And many of the slides that we'll be going over next were borrowed from IHI, which is an excellent resource for looking for change and improvements and strategies to be able to do that for both you and also for your organization. So we're going to go through some kind of basic building blocks on how to approach change first, and then we'll talk about some specific ways that you can do that and some other tools that you can use. But first, let's start with the framework of change and improvement, in particular, through the Institute for Health Improvement, IHI. So the first step when looking to make a change, especially an improvement in a situation, is you need to set an aim. And ideally, this is something that is being done as a group and not as an individual, although you can also use this for yourself in terms of those personal goals we talked about. If you wanted to, say, set an aim of increased exercise, you could set that aim and you could use the same criteria to follow that through and then see how well you've done. But overall, so it's important to start with thinking about what it is you're trying to accomplish. And you really need to articulate that and maybe write that down of what the goal is. What is the aim? The next step is thinking about measures for which to track that aim. So whatever it is that you've decided that you wanted to do to make a change, how do you know when that change is actually an improvement? So change can happen, but as we all know, it's not necessarily always for the best. But how do we know when that change, either in your personal lives or in your organizational lives and at work, can be a change for the better? So you need to have a system to track that. And there's many different ways, again, to track that, and we'll talk about those in a little bit. Next, need to look at developing changes over time. So what we know about change is that it changes. So once a change is made within an organization, you need to be able to identify it, benchmark it, look at how you got there through, maybe it was technology or in other ways, or maybe it was a process analysis that you used in order to get there. But you need to think about how you not only maintain that change over time, but what can you do to make sure that those changes are part of the structure in the way that you think. So in doing that, we need some creative thinking. You also need to think about change concepts that can help you make those changes. Because as we know, when things change, they can't stay like that. We need to continue to look at ways to do continuous quality improvement in order to maintain the best outcome. So I'm hoping people have heard about the PDSA cycles. This is something we're going to talk about and how to implement this and do this for yourselves personally as well as organizationally. So plan, study, do, act cycles are really aimed towards small tests of change. So if you're looking to make a difference in what you're doing now and change something, do it on a small item first rather than going for a big ticket item. And then run that plan, do, study, act for a while, generally a week or two tops, and then reevaluate where you are with that. So when you're walking through that PDSA cycle, make sure you have the questions that you're asking. So the who, what, when, and where of what's going to happen. And then observe the test and then document the results somehow. You can use run charts to study it, analyze the data, get the help and input of any CQI folks that may be within your organization to help you analyze that. And then lastly, make a change and then plan for the next cycle and implementation. So as we know, those of us that are in a place of work, we have those around us that are often the people that can make changes within our organizations. So the next part of this discussion today is to talk about how to get leadership involved and possibly give leadership some direction for moving beyond just people being unhappy and burned out, but how can we use the IHI framework to look at a way of making change within an organization that will make changes for everyone and have a positive outcome. So when we're thinking about a multifaceted nature of work dissatisfaction, for instance, or how to restore and foster and nurture health in the healthcare workplace, it's evident that leaders often find it challenging to see a way forward, to move from the current state to one of joy in work. So here are some steps that leaders can take in order to find that path forward. Each of these steps is foundational, and it's important that you follow them in this order so that you can identify what's going on and you can move actually towards lasting change. So these are set out for you as a staircase, and we would start at the beginning at the bottom, which is the first step, which is engage. Leaders need to engage colleagues to identify what matters to them most at work. And it could be asking that question, what matters to you? Second step, next, leaders must identify the process, issues, or circumstances that may be impediments to what matters, also known as the pebbles in your shoes, the things that bother you on a day-to-day basis that you wish were different, or the staff may wish were different, but may be shared amongst a number of staff. Next, there needs to be a partnership to move forward with multidisciplinary teams to come together and share responsibility for removing these impediments if possible, and to focus on what you can do. So don't focus on, dismantling the entire building and rebuilding again, but maybe small pieces that could make a big difference. And this is where it's important for staff to have input on what those small changes might be that would help improve their day, and also help them to bring joy in work. And then lastly, leaders and staff can use improvement science together to accelerate that improvement and create a more joyful and a productive workplace. So everything I've talked about here is predicated on the fact that your staff and your leadership are having this conversation. And depending on what your role is within the organization, as a leader, you can bring this back and talk to other leadership staff within your organization about why it's important. And then you need to bring in the staff to talk about the fact that you would like to make some changes. And it can be the other way around as well. I would encourage all of you who are working in a particular location to meet with your immediate supervisor and talk about some of these issues with them so that they know and understand that there is an issue going on. And then you need to gauge the interest in leadership for being involved in making change. In order to get ready to make change as a leader, there are some basic steps that I would suggest that people do to kind of lay the groundwork for a different kind of a conversation than maybe going on right now organizationally. So, and these are three things that are really important parts of this process in order to make you successful in doing this. One is by use of a STAY interview, which we'll talk about more in the next couple slides. Also, there needs to be adequate staffing, particularly at the leadership level, and the organization itself needs to be engaged in the process and identify that there is an issue and something that they want to change. And then lastly, ask for a designated senior leader champion, somebody who staff can go to as you're working through these issues, somebody who has a vested interest in this or a background in this or an interest in helping to make change within the organization. It's really important for there to be one person or maybe even two people, depending on the size of your organization, for your particular team that you can go to as you're going through this process, because staff will have questions. So that's important to get leadership buy-in on this. So this is the first step, and we had talked about being setting the groundwork and preparing for this. And this is based on something called the STAY interview. So probably 5 or 6 years ago, I became aware of the STAY interview, and this is kind of the opposite of the exit interview. So these are interviews that you do, supervisor does one-on-one with staff on a regular basis, whenever you see them. So the STAY interview gives the leader or the manager a better sense of what's going on with the staff and can give you tremendous insight as to what may be some of those pebbles in their shoes and things that they're coping with or having issues with. So it's generally something you want to make sure you have some dedicated time to do. Stopping in on the fly and doing this is difficult to do. So when I would do it with my staff, I would let them know ahead of time that it was coming. I would either try to do it over a lunch break or a break so that we actually had some time to talk and interact. So, and this kind of boils it down to the most important questions as part of a STAY interview. And for those of you that are interested in this, there's a whole book about this called The STAY Interview, which I would encourage you to read. It's a quick read and it's really very well done. So the first question is, what opportunities for self-improvement would you like to have that go beyond your current role? Next, what talents, interests, or skills do you have that we haven't made use of, or we may not even know about? What have you felt good about accomplishing in your job, in your time here so far? And then the last question, if you could change one thing about your job, the team, or the company, what would it be? And that's not more pay or more vacation time, because again, we need to frame this within what's doable and what's actionable. But I've gotten some very interesting answers to the last one. And sometimes the one thing that could be changed is something that you as a manager or leader may have some control over, and you can actually do on the spot for that person. And when you do that, people know that they've been heard, they know that you care about what's going on with them, and it helps them feel more like they're part of the team. Next step is to identify those impediments. So the things for each individual, and they may be different for each person, and there may be some collective issues that are going on that, are going on for a team. And be sure you really want to get down to the individual level of building on the what matters to you and what is it that's making work or life difficult for somebody. And it may be something like short staffing. It may be not getting out on time. There's a number of different reasons why people may be feeling less joy at work. And then set some priorities around these issues and talk them through together. So that STAY interview, and then also identifying what this issue may be and looking at priorities, is something that can happen in the same conversation. It shouldn't happen only once in time. It should happen each time you see that person. It should be a conversation that's ongoing. So there's some issues here of things that may be impediments to joy in work. And again, this can be done on a larger basis in talking about a health team and what's going on for that particular team and what things may be getting in the way. You can boil it down to smaller groups where you're looking at individual team members. And when you start to hear a theme coming up over and over, then you know that it's beginning to impact the group. So once you've identified those things, what you can do is you can create work groups to work on those. Also important to share the good things that are going on, and remember that working through difficulties is certainly what we want to do, but we also don't want to lose sight of the fact that there's also a lot of good work that's being done. And then document those things. One of the ones I heard over and over in my STAY interviews with people was about getting out late. And that seemed to be a universal theme with many people. So it was something we talked about individually. It was something we talked about when we had team meetings. I also asked staff to come up with some solutions of ways that they might be able to get out on time. And we came together as a group and made some changes organizationally that were very impactful. So once you've done that and you're really committing to a systems approach in order to make this a shared responsibility. So remember what we said about teamwork. When you're standing at the bottom of that hill, if you're standing there alone, you're going to feel that this is overwhelming. But if you're standing there with other team members, you'll feel better about doing the work, and you will feel a joint responsibility for that and a shared responsibility, because it's not just, more than likely, it's not just your issue. And everybody's got a role to play in making things better. And again, as we talked about before, there can be a champion on the leadership side as well as a champion on the staff side. who can help to move things forward and make sure that things are actually happening within the organization and then report back. So making a workplace joyful isn't any one person's job. It really has to be a team approach between the leaders and the staff. And you'll have to figure out the best approach to doing that, whether you go to supervisors or leaders within the organization, get their buy-in first, talk with staff about it, but ultimately nothing will be successful unless everyone is working together. And this step here is important as well because improvement science really can help us to move through this process. Even though a lot of it has to do with how we think and feel, much of it, especially when there is not joy in work, staff will have difficulty getting through their day-to-day, and it makes everything that much harder. So while improvement science does focus on kind of the systems approach to what's going on, there are ways to be able to measure change within the organization where you can actually show that there has been improvement. And we're going to talk about those in just a little bit. So as I mentioned in the last webinar, we talked about improvement science, and doing anything really requires SMART goals. So these are goals that are very specific. They have to be something you can measure. They have to be something that you can articulate, that are realistic, and that are time sensitive. So think about what it is you want to change and make sure you can fit it into a SMART goal, because if you can't, then it's going to be very difficult to track it over time. Also, a suggestion for making changes, again, is to start small and then use whatever data you get to refine the test itself and then to make additional changes. And make sure that the change idea works first before doing this in a large group. So you don't want to make a change across an entire healthcare system only to find out that it really is not the right way to go. So you want to do those small tests of change. We talked about the PDSA cycles first before taking this out to the larger group. It's really important to track those results over time. And this improvement needs to be shared both with leaders, but also with each individual within the organization. So ideally, these are things that can be talked about at staff meetings, and there can be input from the staff as to how things are going, and even suggestions for how to make improvements in the future. So we had talked here again about SMART goals and those shared measurable goals. Coming up with a SMART goal has everything to do with not only the work environment, but you also need to think about your patient population and what's actually doable and what's within your control. So think broadly about stakeholders when you're thinking about goals. And the getting out on time one is actually appropriate here, because if staff's getting out late, it means that patient visits are probably going long and patients are also waiting. So there are many things that will have spillover into other areas of the work that you're doing, and think about how maybe you can then track those so you can see changes over time. And we had talked about this again in the last webinar of how to do something simple, and this is just one way that you can track this. So if you come up with your SMART goal, whatever that is, and then how you're going to measure that, make sure it's something that's actually doable. Remember, something within your control and that it's realistic. And then you need to think about it needs to be time bound. So again, small PDSA cycles using SMART goals are best when done for no more than 1 to 2 weeks. Don't wait, or don't have it go on for 3 or 4 weeks. It's much too long, because you'll know right away if things are not working, and you might even want to tweak it and make changes. But these cycles should be very short. And once you tweak them and you find out what it is successful, and you can do that by looking at something simple like this as a run chart. and you have whatever your goal is. And say, for instance, the goal is, for all staff to get out on time. So in this case, what they did was they put an improvement team together and made some changes to the workflow. It took a little while to get that in place. Changes were implemented, and then they saw a test of change. And this can be very powerful if you can use something like a run chart, where you can see, and it can be whatever the metric on your X and Y axis. But this is very, very powerful. Even to do this, again, make sure leadership is involved. But once you have those tests of change in these run charts, you bring that back to the larger leadership group, or your managers and leaders can bring that back to the larger group and show that there's good data behind the ask. And you will have support from the organization. Well, hopefully you'll have support from the organization when you do it in this kind of a methodical way. So these are just some ideas of things that you can use in terms of changes that you may want to track. I know a big one for me in my role as a manager and leader was both turnover and absenteeism. And again, these are just some suggestions of things. Those are the first two that I put because those are the ones I think that impact staff on a day-to-day basis more than anything else. Because as we all know, when you lose one person in the equation, suddenly your workload goes up dramatically. Also, those people that seem to be calling out a lot has a very difficult effect on the day-to-day work. Looking at workflow. It might even just be the way a patient moves through your office, or how the handoffs are going. And maybe patients are waiting too long at some point in the handoff. Patient and as well as staff satisfaction scores. And we'll talk about, again, in a little bit, ways that you can actually track these. And you can do a pre and post test, particularly for staff, but also for patients to see if improvement goes up. Improving time management, and that's the getting in on time and leaving on time. We had talked last week about provider errors, and when we are feeling overwhelmed at work, we do tend to make more errors, and those errors can be deadly, as we know, and we never want anything bad to happen to our patients. So it may be something that you're tracking already, or there may be other NQF measures that you're tracking. Think about something you're already tracking within your organization. That would make it very helpful for you to get some information about that. And we had also talked last time about when providers are more burned out, they tend to write more prescriptions. So that might also be another simple thing to be able to track, particularly in an EHR, if you can track numbers of prescriptions. So again, talking more about joy in work and measurement, I can't stress the importance enough of identifying what the issues are and then finding ways to be able to measure change over time. You can do that both at a system level. Again, we had talked about patient satisfaction, provider satisfaction, engagement, absenteeism. Those may be system level issues that you're dealing with right now, or there may be some local measures, things that are happening much more frequently, like the getting out on time each day. Maybe that's an issue that you want to track, and that's something that even the staff can help and track over time. So all of these are potential tools, survey tools, for you to look at a systems level approach for how to deal with measuring joy in work. And I'm just going to highlight the three that I have starred here as particularly good. People, I think, know about the Net Promoter Score, but they may not know about some of the other ones. But let me just tell you a little bit about the Clinical Leadership Dimension Assessment. So this can be administered to individuals or to groups, and the individual data that comes from this assessment highlights areas where multiple supervisors or areas of leadership need additional training or improvement. Once you complete this assessment with a group, it facilitates conversations about bright spots and yet areas for improvement. So again, something that could be done at a at a high level for a system level approach. The next one I wanted to touch on was the AHRQ safety culture. These are surveys that are used to assess the current safety culture within an organization, raise awareness about patient safety issues, identify areas for improvement, highlight strengths, and provide the ability to view the data over time. This data tool can be used for internal comparisons between specialties or areas of the organizations or different groups, as well as external comparisons with other organizations and throughout the healthcare industry. And then lastly, we know about the MASLAC burnout inventory. I think that's something people are familiar with. You can take that personally. It's an older tool, but it's very accurate, and will take you through Maslow's hierarchy to see where you personally are. Another one on a personal level is called the Mini-Z. And this is a short 10-item survey that measures burnout in the healthcare practice environment that an individual is working in. The survey is really intended to be used on an annual basis, but completed by all providers within a practice. And the data can be used to measure, get baseline data, and then gauge the overall staff wellness within an organization. So while it's done for individuals, it can also give you a sense organizationally of where your organization stands in terms of burnout. And you may have some surprising results there. And these are all open source. And all the references are there at the bottom for you to be able to access them. So going from the system level to the local level, there's some additional tools that I wanted to share with you, and all three of these I think have merit in different ways. And again, they're just ideas for figuring out where to start with making improvement within your organization. And you have the daily visual measure, the 3 questions daily, and then a pulse survey. So remember, these are more at a local level, individual level. So this first one with the daily measure survey is taking a look at what the work environment is in real time. And one of the things that IHI used as a visual measure of this was a glass jar placed by the entrance to the organization, and for staff to drop in 1 marble each day. So a blue was a good day when an individual made progress. Tan was for a day when they felt that they were kind of stagnant and hadn't made any progress. And then you have a designated staff person that counts the number of blue and tan marbles each morning and tracks the count. A quick glance at the chart, at the jar itself, enables staff to gauge the mood of the organization. Leaders can also use this data to assess levels of joy in work. So again, it's very visual. You can take a look and get a sense of where that organization may be on that particular day. The 3 daily questions are questions that you would ask yourself. And these are hopefully questions that staff will be asking of themselves, but also leaders can use these questions when they're having those stay interviews or conversations with staff to get a sense of how they're feeling. Because as we said before, trust and psychological safety are essential as part of a team. So are you feeling that you're being treated with dignity and respect? Do you have what you need to do your best work? And then also, are you being recognized and thanked for what you do? And these are questions you should be asking yourself, and questions that leaders should be asking you as well. If you have a leadership staff that maybe is not particularly engaged with this, again, this would be something simple to bring back and start a conversation about how they can be better aligned with what's going on with their staff by having these questions answered. So again, just another tool that may work for you. Next is the pulse survey, which is very similar in many ways to the 3 questions. These are done as a questionnaire. It can be done online. It can be done on paper. This is a way for staff to be able to, again, do an assessment of themselves and how they're feeling, so you can then use that information and get a better sense of how the organization is doing. And this gives an organization some good data in overall staff engagement. And you can see whether or not, changes that you may have tried to implement have worked or not by doing this over time and seeing if this pulse survey changes or things improve. And if they don't, I would strongly encourage you to go back to leadership and have some conversations about why things have not changed. It's really important to be part of the solution. Organizations can be very large and you can feel lost within them, but again, it's incumbent upon all of us to do the work ahead of time that we need to do to make sure that we are our best selves going in, and then maybe to educate our managers, supervisors, as well as the organization as to why taking care of each other individually and feeling as if you're part of a team will ultimately affect and improve what's going on in the workplace. So just to recap what we've talked about, and I've given you lots and lots of information here, and as Mariah said earlier, all of these slides are available for you, as well as the resources, which are all open source. But just in conclusion, we know that healthcare is increasing at alarming rates. Rates of physician suicide are some of the highest suicide rates we have in the United States. We also know that burnout can cause errors and it can compromise patient safety. There can be personal repercussions for staff and clinicians, and those repercussions can affect us both personally, that can also affect the bottom line for many healthcare settings and take money and resources away from places where they're really sorely needed. We also know that the patient-centered medical home model has protective factors that are built in. So if you are not part of a patient-centered medical home model, I would encourage you to talk with leadership about how you can become one, because much of the work that is done to become a patient-centered medical home really lines up very nicely with joy in work and bringing the joy back to the workplace. Improvement science does drive how things are going to change and how you can track what's going on within the organization. So we don't want this discussion of joy and decreased burnout to be only about how we feel, but it also changes the environment within which we work, and we can change that environment for the better. So it's important to address this not just because of the personal toll that it takes, but also the organizational toll that it takes. And then lastly, think about both local and system approaches and different tools, and I've given you a number of them, including my favorites, to start by doing an assessment. So you need to start at the beginning, do a self-assessment, then think about workplace assessment, in order for these changes in change management to be successful. You need to be clear about where you are, and you need to be clear about what's within your power to change, and also get a sense of the leadership within the organization and what is their commitment to looking at these issues with you as a group. I can tell you that working as both a staff person, but also in leadership, when people came to me with a problem, I expected them to come with a solution. And I've offered you many different possible solutions that you can bring to your organizations. Many of them are data-driven, where you can actually implement things and change, and you can show change and success. And that's ultimately what we want, because now what's happening is many people leave organizations because they don't feel as if they're able to control their environment. And these are hopefully tools that will help you feel that you have what you need in order to make change. So just some things to keep in mind as you're moving beyond burnout and back to joy in work. And I've outlined some homework here that's completely up to you to do, but and broken it down by both organizational as well as personal strategies. We know that a team-based care approach, which is the framework for the the patient-centered medical home model is what works in helping to decrease burnout. If you do have a CQI or a quality team in place, make sure you identify who they are, talk with them. It's very likely that you're already tracking some measures now. There's no reason to recreate the wheel. If you can tap into what some of those measures may already be that you're tracking, and then develop a path to making some changes using those PDSA cycles, you will get the buy-in organizationally, because many healthcare systems are already tracking measures now. So the more that you can identify those and maybe help with meeting or improving some of those metrics, it's a plus for the organization, it's a plus for the staff, as well as improving patient care, which is why we do what we do, because we care about our patients. Very important to always be using SMART goals when thinking about any type of change that you want to make. So it should be something, again, SMART, measurable. It needs to be something that is actionable and realistic and must have a time constraint. Anything that you're going to set out to do, again, I would suggest not looking at it for more than 1 to 2 weeks in terms of the plan, do, study, act cycle. If you find that it's not working, it gives you time to redirect. Don't do tests of change for longer than a couple of weeks. People get very wary when things are not going well, and maybe you want to stop it early if it's not going well. You can always go back, regroup, and start over again. If your leadership is not aware of a STAY interview, I would encourage you to get them the book. It's a slim book. And talk about it and talk about why it's important and look at it yourself. And it really is an incredibly effective way to not only feel heard, but to feel inclusive. Stay interviews don't take more than a couple of minutes. It may open up additional conversations, but staff know that you care when you're asking those questions. And then again, on just the personal level, you know, making sure that you pick one care strategy that we had talked about and do practice that daily or weekly as often as you can. Gratitude journal is another one. I know it's often easier to think about what's wrong in life, but if you can find what's good about the day, even if you had a really bad day, it can help put that in perspective. And then think about for yourself one change that you'd like to make to bring the joy and work back for you personally. You can create your own SMART goal and you can conduct your own PDSA cycle and then look for changes. And with that, I'll open it up to questions. Mariah, if we have any questions on the line.
Sure. Thank you again for that presentation, all of that great information and so many resources. We'll make those all available through the slides, and maybe also, because there are so many, we can include those on our website when we send out the link to the recording as well. If anybody does have a question, we just have a couple of minutes left. Feel free to jump into the questions box and send your questions our way, and I'll read them out for you. If there are any questions, I know there's a lot of information coming at you at once. If you do think of anything after, Cheryl has provided her contact information there, and my contact information is up at the top of the presentation, and I'll be the one emailing you. So feel free to get in touch ongoing.
And I just wanted to mention, too, if you follow me on Twitter at CHERF10, I'm always looking for kind of new and interesting things that are going on in the field of healthcare. I have a wide swath of things that I look at, but there's often interesting information. I try to keep it relatively positive, but articles and just other things that may be of interest to you in the field of healthcare. As we know, healthcare is changing so rapidly, and so it seems. So I try to keep that up to date with the times and what's going on. Also, too, if you wanted to go to our website at nurseledcare.org, I also provide a Lunch and Learn series once a month on topics that may be of interest to nurses and nurse practitioners, also to physicians and others, healthcare related. So please take a look. We have upcoming webinars that'll be on there. But also there's a history of the webinars that we've had in the past if you have an interest in going back and looking through that content. And then you can get in touch with us directly and follow us at Nurse-Led Care on Twitter as well to see what's going on with us. Any questions in the chat box at this time?
I haven't seen any come in. Everyone's been a little quiet today, which understandable. But
okay.
We'll look forward to keeping in touch through all of those channels ongoing.
Great, and it's a lot to digest. I would strongly encourage everybody to download the slides, go through them, think about them, start with your personal goals first and your personal assessment, and then, do what you can do. We're only one person, but we can make tremendous changes in ourselves, and that's where it starts, and then we can spread that to others, but we have to be good with ourselves first. So again, on behalf of the National Nurse-Led Care Consortium, I wanted to thank ACU for having this webinar today and for the ability to be able to speak to you about this topic that is very near and dear to my heart. So thank you again. I appreciate that.
Oh, thank you. Thanks for joining us and sharing all of this great info with everybody attending the series and watching the recordings, hopefully, in the near future. As I mentioned at the top of the webinar, we'll be sending out the links to the recorded session, and I'll also include links to previous sessions in the series so that folks can catch up if they'd like. Ahead of our next session, we'll be back to our regularly scheduled Thursday webinars next Thursday, May 9th at 1 p.m. Eastern. We'll look forward to having you all with us, and thanks again for joining us today. Have a great day, everybody.
Thank you.